How to remove crow's feet. Now, for us to understand how we remove crow's feet, we firstly have to think about the different causes of crow's feet. So let's get into it. Wrinkles around the eye are caused by repetitive motion of the muscle around there called the aubicularis oculi muscle. Now, when we're really young, you don't see that muscle's action because our skin is very elastic, it's full of collagen, and the fat underneath the skin is very full. So you don't see the appearance of those wrinkles. For us to consider in a consultation how we are to manage those wrinkles, we like to think about them in terms of 3 different areas. So skin being one, fat being the next layer, and then muscle being the layer after that. And you can see in this diagram here, you can see the skin, the fat, and then the muscle. So depending on your unique circumstances will depend on which one of those layers that we target most in treating your crow's feet around the eyes. So if we want to get into it and think about skin first, the things we want to do to increase elasticity and to stimulate collagen may be your laser or energy-based devices, so CO2 being the most popular one. Radiofrequency skin needling is also another popular option. And then other things to treat the skin may be PDO monothreads, which will cause an intensive collagen stimulation around there and help to thicken the skin. Now, the second layer, we're looking at the fatty layer, which goes down as we get older. And we may want to look at different ways to volumize that. So there are volumizing products that we use that your clinician will run you through. And there's also collagen stimulating products. And both of those have the goal of increasing volume in there and blunting the transition between the muscle and the skin, and hence improving the appearance of wrinkles. Now, one of the more common targets to treat when we're looking at consulting for wrinkles around the eyes are muscle overactivity. And what we like to do is look at where exactly around this muscle, and you can see this image here of the muscle, how it wraps around the eye. You can see that some people's muscle is more prominent here, more active here, some more active here, some more active here. And we will look at your unique circumstances and decide which combination of those treatments are best for your individual circumstances.